Suppose a hospital is using a machine learning model to detect a certain disease. Now, assume that there are multiple rows in the data set that are used for training purpose. When you're training the classification model, every row will have a label. That label is, let's say, positive or negative. It's a binary classification problem. So there are only two labels, positive or negative. So the rows which have the label as positive, will call them as actual positive, and the rows which have the label negative, will call them as actual negative. Now when the training is over, we want to test our classification model. When we are testing it, we'll give it some other rows of the data set. Now in those rows, what we'll say is that there are some actual labels present, actual positives and actual negatives, and then for some of the rows, the model will correctly predict them as positive. So we'll call them as true positives. And for some of the rows, the model will correctly predict the negative rows as negative. So we'll call them as true negatives. But there might be some rows which actually had the label as positive, but the model classified them as negative. So those will be false negatives. And there will be some rows for which the label was negative, but the model falsely or wrongly classified it as positive. So those will be labeled or called as false positives. Okay. So therefore we build a matrix. Now it's not fixed or it's not compulsory that rows should be the actual values and columns should be predicted values. So always check how the data is present if you are analyzing some given data. But in this case, in this video, what we'll do is we'll keep the rows as actual positives and actual negatives, and we'll keep the columns as predicted positive and predicted negative. So let's say there are 100 patients, and out of those 100 patients, 45 were correctly predicted as having the disease and 40 were correctly predicted as not having the disease. So those are true positives and true negatives. There are 5 patients who actually had the disease, but the model missed them. So they were falsely predicted as negative. So those are false negatives. And there are 10 patients who did not have the disease, but who were falsely labeled as having the disease. So they are false positives, falsely labeled as positives. Now we'll study 7 measures. First measure is accuracy. The simplest measure, it simply measures how many were correctly classified as having the disease and correctly classified as not having the disease. That is true positives plus true negatives divided by the total sample size. Now carefully observe the classification, carefully observe the confusion matrix. If you take the sum of all the entries in the confusion matrix, you should get the sum as the total number of samples. So the denominator will be true positives plus true negatives plus false positives plus false negatives. Basically, out of all the total samples, how many predictions were correct? So in this case, the number is 45 plus 40 divided by 100, which is 0.85 or 85%. Precision tells you out of all the cases that the model predicted as positive, how many were actually positive. So it is true positives upon true positives plus false positives. Okay. So in this case, it is 45 upon 45 plus 10, that is 45 upon 55. We can also remember this as you take the sum of the column predicted positive. In my case, in my table, in my confusion matrix, it's the column predicted positive. So out of all of the people who were predicted positive, how many were true positives? Okay. Then the next measure is recall. Now this measures out of all the actual positive cases, actual positive. So now if you go back to the table or the confusion matrix, I am saying out of all the actual positive cases, how many were correctly predicted as positive. So true positives upon true positives plus false negatives. Denominator is the sum of the actual positive rows and numerator is the true positive count. Okay. So in this case, it will be 45 upon 50, which is 90%. Now, recall is also called as sensitivity because think about it. It's like out of 100 patients or out of 50 patients in this case, 45 were correctly identified as positives, right? 50 positives, like 50 patients, 45 correctly identified. So sensitivity is 90%. If I say that out of 50 patients, 47 were correctly identified. So I'll say that sensitivity is 94%. So basically, I'm not bothered about, right now, not bothered about false positives. Okay. If you see in this formula, nowhere do we bother about false positives. We only bother about true positives ratio with true positives plus false negatives. So if I make my model more and more sensitive, basically what I'm saying is I should not miss any case or any positive case. I should not miss any patient. If it is used in spam detection scenario, I should not miss any spam. If I'm using in fraud detection scenario, I should not miss any fraud. But that naturally comes with a drawback. Okay. So the drawback is if my model is too sensitive, it is positive that many normal emails get marked as spam, or many genuine transactions will get blocked or flagged as fraud, or many, let's say, people who do not have the disease will also have to go through some expensive procedure and of course the stress because they were marked as having the disease or they were marked as positive by the model. So that's an issue of having a highly sensitive model. But the advantage is that I will not miss any patient or anything. Now, as you can clearly see, there is a trade-off between precision and recall. Okay, so if the sensitivity is high, automatically the precision will be low because then the precision is the ratio of true positives upon true positives plus false positives, and sensitivity does not worry about false positives. So I will make my model as sensitive as possible, and it is possible that it marks many of the negative cases also as positive, only to make sure that it does not miss any true positives. So false positives will also increase. So my precision will drop. If my recall increases, the denominator of precision will increase. So my precision will drop. We want a measure which will balance both precision and recall. Okay. So that is called as F1 score. Now, when I say it balances precision and recall, I mean to say that it tries to find out whether the model has a good balance of precision and recall, whether the model that we have created is good enough such that it has good precision as well as it has good recall. So it takes the harmonic mean of precision and recall, that is 2 upon, because there are two quantities of which we are taking a harmonic mean. So 2 upon 1 upon precision plus 1 upon recall. So this will be 2 into precision into recall divided by precision plus recall. So in our case, F1 score will be about 85.71%. Now let us go to the negative class. Specificity answers the question, out of all the negative or actual negative cases, how many did the model correctly identify as negative? So specificity is true negatives upon true negatives plus false positive. Here the denominator is the sum of the actual negative row and numerator is the true negative. So which measure does it mimic, or you can say it's almost similar to that? So it's similar to recall. In case of recall, we had seen the row of actual positive and the numerator was true positives. Here in case of specificity, the row is of actual negatives. So the denominator is the sum of actual negatives and the numerator is true negatives. Okay, so here it comes out to be 80%. False positive rate. False positive rate is out of all the actual negatives, how many were wrongly predicted as positives. Okay, so false positives upon true negatives plus false positives. Okay, now if you consider specificity is true negatives upon true negatives plus false positives, and false positive rate is false positives upon false positives plus true negatives. If you take the sum of both of them, you will find out that sum comes out to be 1. So you can think of it like these two basically add up to 1. So false positive rate is 1 minus the specificity. Similarly, there is a false negative rate. So false negative rate is out of all the actual positives, how many did we miss? Instead of how many did we get, now we are saying how many did we miss. So false negative rate is false negatives upon false negatives plus true positives. Again, notice the relationship between recall and false negative rate. So recall is true positives upon true positive plus false negatives, and false negative rate is false negatives upon true positives plus false negatives. So you can say that false negative rate is 1 minus recall.